welcome back to my YouTube channel. And my name is Estudia Ningtyas. I'm studying in Polytechnic Catholic Mount Wijaya Semarang, Pharmacy Study Program.
Case Study 1. Privacy. Dr. D was an obstetric or gynecology resident pursuing a joint residency at the State University Medical Center and the Regional Hospital. During an invasive surgical procedure, Dr. D was accidentally cut by the attending physician. The record does not indicate whether there was any actual blood contact between Dr. D and the patient. It appears there was no blood exposure, although no one can be certain. The following day, Dr. D voluntarily submitted to blood testing for the HIV virus. The result confirmed that Dr. D was HIV positive. After being informed of the test result, Dr. D willingly withdrew from participating in further surgical procedure, informed the appropriate official of his condition, and requested a voluntary leave of absence. Upon investigation, the medical center identified 269 patients who had been involved to some degree with Dr. D during the course of their medical treatment. Likewise, the hospital identified 168 patients who had been in contact with Dr. D since the time of his joint residency. Unfortunately, hospital records do not necessarily indicate each time a physician is cut, nor do they specify the distinct role of each physician in a surgical procedure. Thus, every patient with a reasonable chance of exposure to Dr. D was included in the statistic outlined above. But medical center and the hospital filed petition alleging a compelling need to disclose information regarding Dr. D's condition to those patients potentially affected by contact with him. In addition, the hospital believed there was a compelling need to disclose Dr. D's name to the other treating physician in the department, so that this physician could contact their patient in the event they had been assisted by Dr. D in any invasive procedure. In response, Dr. D asserted his right to privacy, arguing that no compelling need was tantamount to a justification to disclose his HIV-related information.
Okay, and then I want to answer question from my lecture about case study 1, and the question is: should the hospital disclose Dr. D disease? In my opinion, is no, because the hospital does not have the right to reveal the disease. Dr. D privacy rights are no different from others. But Dr. D disease can be contagious, namely HIV/AIDS. HIV is the two species of lentivirus that causes AIDS. This virus attack humans and the immune system, so the body becomes weak in fighting off infection. HIV transmission mainly comes from contact with bodily fluids such as blood and sperm. In addition, the public's right to know about incidents that might affect, they are also part of their right to dignity. In my opinion, the solution done by the hospital is the patient who has been treated by Dr. D since his medical record, then contact the patient's contact and ask him for an HIV/AIDS test, and if positive, should be treated. One of the most common practice for balancing these two rights is only disclose relevant information while avoiding disclosure name, etc. And through what was said in court, the hospital can convey confidential information about Dr. D because of an urgent need to provide information and care for patients who are potentially exposed to HIV. The solution for hospital should be paramedic must be considered, namely by checking the health of paramedics every 2 weeks or once a month, and then the provision of personal protective equipment must be as complete as possible and be used according to procedures for preventing transmission of the disease. Okay, this is my opinion, maybe useful.